Okay, so hello everyone and welcome to our session for today. Today is a skills mastering session. We are going to master management, which is one of the most tricky skills in PLAB 2. If I say almost all of the candidates are struggling with management, I'm not exaggerating. Okay, so all of the candidates are struggling with management. Okay, today we are going to focus on management part. We are going to find out how to state the diagnosis correctly and professionally. Okay, what are the key elements of management? Yeah, and we will find out together how to get the full marks, the 4 in management part. Okay, for people who are joining us just now or new with us, we have a session called Skills Mastering. We take a skills from the skills areas in PLAB 2. We take one in a specific session, all right, and we focus on this skill. We try to find out how to master this skill, okay? And today is the management skill, all right? So, what's the plan for today? We are going to focus on management of the medical cases. All right, we have in PLAB 2 medical cases and ethical cases. Our focus today is the management of the medical cases. We will master together the ethical cases in another session, maybe the next session or the session next month. Let's see together how we are going to arrange for that, but today is the medical cases, okay? Our focus is the management part, all right? We are not going to take the case as a holistic case in 8 minutes, all right? Our focus is in is the management part, okay? I'm going to give you the history, the examination findings, everything about the case, and we will focus on the performance in that management. Okay? We will have 3 to 4 cases, okay, as the time allows us. For each case, we will take 2 doctors, okay? By this way, we will compare the performance of the management between the 2 doctors. We will find, all right, which was the best performance, which was the less performance, okay? And by doing that, we learn from the mistakes. We learn which performance should we follow, all right? So, quickly. In the medical cases, we're going to focus on the medical cases today, okay? What they test in the medical cases in terms of the management? They test a kind of a compilation of key elements in the management. What they are, what are they? Your clinical knowledge. They want to see a knowledgeable doctor. They know what is the condition. They know what is the management in terms of the medical part, okay? So they test your knowledge. You have to be a knowledgeable doctor. You have to know what are the managements or the medical managements of each single condition, okay? In addition to your clinical knowledge, your communication and justification, all right? Many of you know that the medical treatment, they know by heart what is what are the medications, what should be done to that patient in terms of the medical part, but they don't know how to communicate their knowledge, okay? So they test your communication, how you're going to communicate the knowledge in your mind to this patient. Maybe this patient is not educated. Maybe they don't know anything about the condition. Okay, so how are you going to communicate this knowledge to this simple person? All right, and your justifications as well. Okay, so while you're communicating your knowledge to the patient, you have to justify things, you have to explain things more, you have to if the patient is asking you for something, why is that, why is this, why is, so you have to justify things to the patient. They test your ability to communicate and justify things to the patient. All right, what else? Your ability to prioritize things. Prioritization. What does that mean? Well, you have to know that there are things that you have to do now immediately, and there are things that you can talk about them later. All right, and how to know that? By knowing the findings. If you pick up the correct findings, you will be able to prioritize things. Should I send this patient to the hospital now, or he can be managed at home? Should I stabilize the pain first, or referring the patient to a specific specialty? What should I do now? All right, let's say a patient who's presenting with severe pain. All right, and in your management, you do everything, refer the patient, do the investigations, do everything, and you forget about stabilizing the pain. This is your priority now. The patient is in pain. In pain, he's uncomfortable. All right, so you have to prioritize things based on your job as an FY2. Okay, prioritization as well in the concerns of the patient. Okay, sometimes the patient doesn't understand the severity of the condition or the urgency of the condition. Let's say a patient who is having stroke, suspected stroke, all right, and he's telling you, doctor, all right, am I going to go to my work tomorrow, doctor? So you have to explain to him that my priority now is the condition that you have. This is a medical emergency. So you have to tell the patient politely, well, Mr. X, I do understand that your work is important for you. Okay, I'm going to discuss that, and we will find together how to help you in that concern. But my priority now is the symptoms that you have. This is a medical emergency, and you have to treat it right now. Okay? So your ability to prioritize things. If you are not able to do that, you will have low marks. Okay? Your plan of management. They test your ability in formulating a plan of management. Are you able to give the patient a holistic approach based on the condition, the severity, the circumstances, and the patient's concern? Are you able to do that or not? If you're not able to do that, believe me, you will have very low marks in the management. And lastly, your safety. Okay? They test a safe FY2 doctor who is deciding the correct, safe decisions. Alright? So this compilation of elements in the management should be shown in the exam. If you don't do most of them, you will have low marks in the case. Alright? Some people just go to the case, do their medical management, and maybe the concern of the patient is his work. Well, I've managed the case and I gave the patient a sick note. I've done everything, but I went out and I got my results and I didn't pass the case. I got only 1 in the management or 0 in the management. I did everything, doctor. Well, okay, in reality, you didn't do everything. You didn't do everything. Okay? Did you communicate correctly? Did you justify things? Did you prioritize things? Did you formulate a plan of management to the patient? Were you safe? Did you do all of that? In reality, no. Okay? So that's why people don't easily get 4 marks in that management. All right? Let's dive a little bit deeply in the management. We have explained what they test exactly. All right? We are going now to make that practical. All right? So the first part in the management you have to think about is this process. Okay? You have to think about your diagnosis, how to tell the diagnosis simply, and how to give a professional or a provisional correct working diagnosis. Okay? And we are going to discuss that, how we give professional provisional diagnosis. Okay? Then, after diagnosis, you have to think about the immediate management. To be organized, you have to find out, what should I do immediately now as an FY2 doctor? What's my job? What are my limitations? What should I do? What is in my hand to do for this patient? Okay? And usually in my course, I use the immediate management as we. What we are going to do as doctors to that patient. Okay? Am I going to send the patient to the hospital to be monitored? Am I going to just refer the patient and send patient home? Am I going to give medications only? The patient doesn't need referral. The patient doesn't need hospital admission. Am I going to do further investigations to confirm? What should I do now to that patient? Okay? So think about the immediate management now. All right? After that, you think about the ongoing treatment. And usually I put it in my course as you. The patient. You as a patient. What should you do? Do you need to do lifestyle modifications and as an ongoing management? Do you need to take the medications as prescribed? Do you need to do some safety measures for yourself? Okay? This is the ongoing treatment. And lastly, the future treatment. What is the future treatment? What is the last step? What we are hoping for? Okay? So, in the future treatment, usually it is the follow-up and the safety netting of the patient. Okay? So, please think about the medical management as a process. I give the diagnosis. What should I do now, immediately? Is there any ongoing treatment? What is the future plan? And remember, not in every single case you will need the ongoing treatment and the future treatment. Okay? It depends on the case and the condition. If the condition is acute, sudden, emergency situation, maybe you don't need to think about the ongoing treatment now. You have to think about the immediate treatment, the immediate management now. Okay? By that I mean what we are going to do in terms of hospital treatment, referral, medications, whatever the management is. Alright? So this is the first part that you have to think of, organization of your thoughts. If you don't have this organization of your thoughts, you will not be able to give a professional management. Okay? The second part in your management is this. You have to give time to the patient to ask questions and to raise concerns. And you have to be all ears. If you don't manage to do that, believe me, your management part will be incomplete. Okay? And by that I mean, by all ears means you have to listen carefully to the patient's concern. Don't listen to part of the question and throw the other part in the bin. Okay? I will give you an example of that. A patient who is asking you, doctor, when I will be getting better? How much time will I take to recover? What's his concern is, when, the time. Most of you, or some of you who don't have good listening, they just think about the recovery. Okay, well, Mr. X, most of people recover fully from this condition, so don't worry about recovery. Did I answer the patient concern? Did I answer the patient concern, doctors? Did I answer the question? Yes or no? No. This was not the question of the patient. Okay? I've just listened by half ear. I got the recovery and I didn't get his concern exactly. Okay? So what's the answer? Well, okay, Mr. X, most of you can recover within 2 weeks. If you don't have a frame, tell him, well, okay, it can take a bit longer. All right? The actual time frame to recover, it's not, we are not certain about it yet. Okay, hopefully it can get better soon. Okay? This is how to answer. All right? So answer the patient's questions correctly, please, and listen carefully. If you don't have this, your management is incomplete. And in my frame, the first thing in the management, addressing the patient's concerns, and then a plan. Concern means the patient will have some concerns, the patient will have some questions, you have to answer them correctly. Alright? The last part in the elements of the management, communication skills. Your sympathy, your empathy, your understanding, sharing the plan with the patient, involving the patient. If the patient needs some acknowledgement of some fears, if the patient needs some support, if you don't show all of that, your management is incomplete. Some of you are perfect in that, but they are not perfect in that and that. Some of you are perfect in that, but not in that and that. Some of you are perfect in addressing the patient concern, and the medical management not very good. Okay? This is the holistic approach. If you don't include these 3 key elements in the management, your management is incomplete. Alright? Okay. Any question until now? Any question, doctors? 3 more minutes and we are going to start the practice. So, any question? No questions? Okay. How to give the diagnosis? How to give the diagnosis? So just to be focused, the first thing we have discussed is what they test. This is diving deeply, how to do that practically, okay? And then we are discussing giving the diagnosis. How to give the diagnosis to the patient? We have 2 main ways to give the diagnosis, either summarizing the positives in the history and examination and give the diagnosis, or using a stock phrase. Well, I cannot say this way is better, and when you use this way you will get full mark, and if you use this way you will get lesser marks, and vice versa. No, it depends on what you prefer, what you are comfortable with, what comes natural from you. Okay, I usually prefer this way, summarizing. You have Mr. X, you have this and this, by examination we found this, and we are thinking about this as a condition. Do you understand that, or did you hear about this before? All right, I give credibility to my diagnosis. I prefer that, but if someone is doing that, this means that they are not good? No. Okay, as long as you are comfortable, as long as you are confident in yourself by saying the diagnosis this way, it's totally fine. Okay, avoid just saying this gives bad impression while you are explaining things to the patient. Okay, all right, give everything confidently, just to avoid this hesitancy. I'm afraid that time will not fit me. Yeah, it depends on what you prefer. If you don't prefer this way, this doesn't mean that you are going to get low marks. Be natural as much as you can, and that's it. Okay. So summarizing, you have mentioned that you have diarrhea for 2 days. Alongside the abdominal pain that you have, and also we found in the examination that your tummy is a bit tender down below. All of these are suggestive of something called stomach bug, or gastroenteritis or enteritis. All right, I'm improvising things now, but just as an example for you how to give the diagnosis. Okay, you have to give the prognosis. This condition is treatable, this condition is controllable, this condition is lifelong, this condition is emergency. So give the a kind of information what this condition looks like. Okay, then check the understanding. Have you ever heard about this? Am I clear so far? Do you understand me so far? You can use that. Okay. Then the stock phrase: from the symptoms and findings that you have, most likely the diagnosis is blah 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 blah. From the symptoms and finding you have, I'm suspecting that you have this and this and that. Okay. So then give the prognosis and check the understanding of the patient. All right. So what you prefer, use, but be confident. All right. Lastly, these are some phrases that you can use just to show that you are following up with the patient, and the other phrases just to involve the patient. Okay. Following up, you can say, are we in the same page? Are you following me so far? Is that okay? Okay. Sometimes pauses can help. Okay. Instead of just using some or one stock phrase like okay, 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 or are you following so far? Are you following me? Are you following me? No, just use some different phrases to just show you are natural, to avoid monotony in the management. Someone is going to ask me, well, doctor, should I use them all? If I don't use them and I just use pauses in between points, will I get less marks? No. If you are natural, if you give the patient time to absorb, if you are involving the patient, if you are sympathetic and empathetic, and just give pauses between the points, this should be more than enough. Okay? So, use the way that you are comfortable with, which comes natural from you. Okay? In terms of involving the patient, it's important, okay, to involve the patient. How to show that you are involving the patient? How do you feel about this? Which one feels right for you? Do you think you can do this and that? How do you feel about that? How do you feel about this? What would you say about that? Okay? Some phrases you can use to show that you are involving the patient. Alright, doctors? Okay? So, before we start practicing, any question, doctors? Dr. Ahmed, what about if I got in a patient concern that I haven't much information about it. Well, you can say confidently, well, Mr. X, unfortunately, I don't have the answer of this or the exact answer of this concern now, right now, but I will double check and get back to you. And please don't say to the patient, I will double check with my senior. Okay? You have ways to double check. Maybe with your colleagues, maybe on the internet, maybe with the researchers, maybe anything, okay? But don't say, I will check with my senior and get back to you. Alright? Unfortunately, I don't have the confidently, Mr. X, that's an interesting question, or that's a good question, but unfortunately, I do not have the exact answer for that. Alright? I'll definitely check and get back to you by an answer. Okay? Did I answer your question, Dr. Ahmed? Dr. Iman Sulaiman, Dr. Ahmed, will this affect my marks? It depends. It depends. If it's something minor, like maybe the time frame of improvement, or what else? Any concern that is minor to the case, it shouldn't affect your marks. But if the patient tells you, doctor, what's my diagnosis now? What do I have? And you tell him, well, I'm not sure, I will get back to the senior and come back, definitely you will have less marks. Okay? You have to show, even if you don't know the diagnosis, you can tell the patient, Mr. X, I cannot put these symptoms and signs in one image, alright? But what I'm thinking about is, give him one differential, which is most probably is the cause, alright? But we will need to confirm that. We will need to do further investigations. We will need to confirm or exclude. And after that, we can say exactly what do you have. Okay? Any question will not affect the patient's safety? What do you mean, Dr. Ahmed? What do you mean?
I mean, the question will not affect my marks if my answer will not affect the patient safety.
Yes, it depends on the question, to be honest. If the concern is minor and you don't have the answer, let's say a patient who is on steroids and he is asking you, is it same to the medications that people the bodybuilders take? And you don't know the answer. You know the answer, but I'm just giving you an example. Will this affect the patient if he doesn't know if it's like the builders or not? No. Okay? So it depends on the concern. Alright? As long as you are safe, natural, answering the question as much as you can, and the patient is satisfied, this will not affect your marks. Okay? Did I answer your question? Just try.
Yeah, thank you.
All right.
Yeah, thank you.
Okay. Dr. Iman Sulaiman, can I say, does this all make sense? Yes, you can. Why not? It's fine. Dr. Amma, I am confused. I thought we can say we will check with seniors if we are not sure. No, Dr. Dr. Iman. Okay? Why do you need to check with the senior about some information if you can just read and find the answer?
Dr.
Your
Sahar,
senior, sorry?
So when do we check with seniors if we get stuck? If we're being safe.
Okay. You check with the senior if you are in the point of reaching your limitations. By that I mean, let's say in a sim man case, okay, You did everything in terms of stabilizing the patient, giving the medication, and you've done your job. Okay, you can involve the senior now. All right, you give, let's say you give an asthmatic patient ipratropium, salbutamol, IV steroids, and no improvement. Then you've done your job. You have to involve the senior now. You've done your job. Okay. You can involve this is in SIMMAN cases. In theoretical cases, you can let's say what you have a medical condition, okay? Let's say erythema or rash in the skin, okay? And you didn't see this rash before. You didn't see this rash before, and you don't know what is the diagnosis, okay? But the patient is stable. The patient doesn't show any red flags. The patient doesn't have any kind of alarming thing. Then you can reassure the patient. You can tell, well, okay, I can see that you are concerned about this rash. To be honest, I cannot put the symptoms and signs that I can see in a specific single diagnosis, okay, or a specific single image. Yeah. This rash could be many causes, could be an inflammatory rash. All right. For that, we will need to do further assessment. We will need to involve the dermatology, okay, the dermatology team. All right. But what I can see that you don't have any alarming symptom. You are fine. Even your lifestyle is not affected, or your personal life is not affected. So I'm not concerned about this rash, to be honest. Okay. And also I will involve my consultant to come and examine you again or reassess you again and give his opinion about that. So you give your thoughts, you explain what you are thinking about, you explain what are you going to do, and then you involved your senior. Okay? This is another thing. The last thing, if the patient asks you something that you never heard about and you don't know the answer, okay, it's always better to tell the patient, well, I do not have the answer now, let me double check and get back to you. Avoid the senior in every single station and every single thing. And in my structure, if you are in my course, Dr. Iman,
Yes.
I just scribbled the senior part, okay? Just to show you that senior is not always important. It's just when you get stuck in a decision which affects the patient's safety.
Okay. Yeah, it's clear now. Thank you.
Did I answer your question?
Yes, yes. Thank you.
All right. Okay. All right. So, any other question, doctors, before we start the practice? Okay. Everything was clear? Did you get an idea about, the holistic approach regarding the management? What should you think while you are formulating the management plan? Yes or no? Just write down if you don't have the ability to switch your mic on. Yes. Okay. All right. Good. All right. Let's start doing practical practice on mastering the management.